And welcome back to the Daily Dish, everybody. If you're just starting your New Year's resolutions, or you're still thinking maybe of what you want to add to that list, you might want to think about how you can improve your health this year.
And joining us now is Charles Henderson with Kearns Community Coalition. And as part of the Kearns Community Coalition, what does it mean to have a healthy Kearns?
Oh, for us, it's about having a thriving community. If you've got your health, then you have the opportunity to be able to do just about whatever you can physically, as well as mentally. If you have a sound mind. But we think it drives, prosperity within the household and the individuals. That's one less thing they have to worry about when it comes to health.
So you did a study to gauge and determine important community feelings and opinions there in Kearns. Tell us more about that.
Yeah, we actually had the opportunity to partner with the Department of Health and Human Services with their cancer genomics program. And it happens to be that Kearns was one of those communities that had a high number of individuals with cancer, and as a result, we were targeted as a community that they'd like to partner with. And as a result of that, they gave us the opportunity to do a survey. And so we sent out a survey to about 2,400 residents in Kearns, a blind survey. From that, we're asking various questions related to cancer, and healthcare. Where they get health care, how they get it, anything that's preventing them from getting health care. With that data, we're looking to, one, educate the community about what what they said. The other is to be able to actually go out and partner with community partners to see what we can do to improve those outcomes.
And speaking of partners, you are partnering with some big time organizations here in Utah, some of the largest. What are the goals?
So our goals in fact, as we back up a little bit, and that when we put the survey together, we actually went out to some of those community partners and said, what are some of the data that you would like to see and would have? And if you could get this data, what would you do with it? And so what we're hoping to be able to do is, once we have this survey finalized, is be able to take that data and be able to push it out to those community partners so that they can start providing better services in our community. We don't have in the boundaries of our community any type of healthcare provider, not even a dentist or chiropractor that I am aware of in our community. We'd love to be able to get a community clinic, and as well as continue to serve our community, which, for the most part, we have some individuals who need help. And that was proven when we had the pandemic. We had the University of Utah's wellness bus come to our community, and there was a number of folks getting not only the screenings and the shots, but they were also being assessed for other health issues.
You're not just talking about adults, you've also met with members of the Youth Council. How do you get the health message across to teens?
It's interesting that youth nowadays are a little more aware of their health. Just as they are more aware of their environments, they are also very much aware of how to take care of themselves. Yeah, there are folks that, kids that are out there that, probably don't have the healthiest choices when it comes to eating. But there are a number out there who actually are aware, and they are taking, steps to try to improve on their own health. And so what we are trying to do as our coalition is prepare our next cohort of leaders to come. And so I don't plan on being, part of the coalition, or at least running the coalition as long as I live. But my objective is to be able to help those individuals, those young folks, to be able to take control of their own community, be those leaders of the future, and understand what it means to be healthy and be able to provide opportunities for them to improve on that.
It sounds like Kearns is becoming a role model for so many other communities. Can they follow suit?
Oh, absolutely. We had an opportunity to go down to the prevention coalition down in, it was a convention down in St. George, and there are a number of communities that are asking us questions about what we do and how we're doing it. Our programs now lend themselves to be able to be done online, so it's not just simply in person. When it comes to data and information, we're pushing it out statewide for anybody who's willing to use it.
All right, if people are watching and they'd like that information, what should they do?
They should go out to, it's the Utah Cancer Genomics website. Go out to our website and take a look at what we're doing as it relates to the project itself. If they have an interest in actually getting involved, please reach out and let us know. We have lots we could do with you, and we'd love to have more community residents actually participate as well.
Jump in there and be part of this. Thank you so much for being part of the show. And everybody, abc4.com/dailydish for more information.
And mykearns.org as well. Thank you so much.
Thank you.